Sit right here if you don't mind. Stay right here. Started doing personal injury. How much has it impacted your business financially?
So only 25% of my practice is personal injury, but it accounts for about 50% of my income.
Would you say that's over 100,000?
Yes.
Over 200,000?
No. But it's in between.
150?
Yeah.
Okay. So you increase your business comfortably $150,000?
Yes.
Would you say that you aggressively do this? Are you kind of pick and choose? Or are you kind of just take your easy time with it?
Easy time with it.
He increased his business $150,000, and what he is not telling you is he doesn't pursue this aggressively at all, and he hasn't for the last 6 months to 8 months. He's been hiring and training an associate doctor. He's just finished building a new office. He hasn't done much of anything with this, and he's increased his business $150,000. Is that not right?
Yes.
That's not even intensively working the system. That's just paying attention to what you're doing, communicating properly, all this material, right?
Yeah, and I've been learning from you for 1.5 years, so I just started incorporating into my notes, and then when I meet with attorneys, I explain a small portion of what you've taught here at the seminar, and then the attorneys kind of go, oh, that's interesting, I've never heard that before. And then, so that's how I'm able to get them to come. The only reason the attorneys came today is because...
Now let me say specifically, let me interpret what he just said. He did not proactively even go and do this system. He just took his existing personal injury case and started applying it. And that's how he got it to increase $150,000. Just with his, in other words, taking notes differently and communicating differently with his existing attorneys. $150,000. Can you see the potential if you actually were to apply it?
Yeah.
Okay. Now, that's from the monetary side, from the chiropractor side, okay? How about the patients? You're now explaining to them, right, how they heal, what their care is based on, the mile markers, documenting it accordingly. How about the therapeutic protocol and response to treatment? How much more accurate are you in treating the patients with the proper therapies and getting better responses?
So with the patients, first, I'm much more confident when I talk to them. I know exactly what to do and how to explain what I do to them, and they respond to that. So they follow my protocols better. They'll say, why am I still doing this? And I'll explain, this is our goal. This is how we tell if we're meeting our goal. And this is how we know when you're done. And this is what happens if you don't heal all the way. And they go, oh, that makes a lot of sense. And so they're much more compliant because, first of all, I have given them a lot of clarity. And second, I say it with a lot of confidence.
And how much,
I believe it.
And how much better is the precise of your documentation? In other words, quantifying and documenting to support the need for care?
Way better. I had some issues with Western states and bringing a preceptor wanted to come work with me. And he went and interviewed every other doctor around and he goes, I want to come to your clinic. And I had some trouble with the college. They said, well, we got these issues. But I still applied. And the college called me and I submitted 2 PI cases because you have to submit documentation to the college. And they said, normally we wouldn't allow a preceptor in this situation, but your documentation is so strong that we're going to go ahead and let him go work with you anyway. That's literally what they said. They said, normally we wouldn't do it in this situation. Your documentation is awesome. We want our preceptor to go work with you.
And that's the college that's supposed to teach documentation, told them that.
Yeah. That's Western States here in town.
And that's why one of the main reasons the associate wants to work with him.
Yep.
For him. And that's why his patients are staying longer and understanding. How, you know, in other words, it's not just money. It's good to make money, right? But it's also, you know, it's primarily important to take care of these people and to try to help them, to not have permanent problems and get their functional capacities back and try to get them to as much as normal as possible. And so how much more is that happening with as far as the clinical response to the patient?
We get way better results with the patient because we get better compliance. I'm doing the same chiropractic stuff I've always done. I change it a little bit. I'm a little more precise.
Let me ask this. Tell me if it's not true. I'd say not just compliance, but quantifying. See, when you quantify better, you know if the person should get more or less or something different. Is that not right?
Yeah, and the patients love it. They're like, where am I at? And instead of me giving an opinion, I say, well, let's go pull up your chart notes. Let's look at this exam now. We're going to compare it to this exam. And the patient goes, oh, I didn't realize I was doing so good. Or they'll say, yeah, I'm not doing better. Here's what we got to do different. So
And,
it's
and
very
what, and
objective.
if you didn't have that high sensitivity testing or high quantification, how well is that going to work?
It doesn't work.
It
It's
doesn't.
just my opinion, and they don't trust your
Yeah.
opinion usually, unless you give them a reason to trust you.
Right.
So.
Yeah, thanks. You know, the money part